Good evening, depending on where in the world you're tuning in from. Now that we have a global clientele and a global audience, I take great delight in acknowledging that. My name is Gideon Orbach. I practice chiropractic here at the World of Wellness. I've had my 16-year anniversary for those of you keeping track, and things are going well for us here, I'm happy to say. So anyhow, I think this workshop, and I call it a workshop because it's interactive. If you're listening in and you have any questions, comments, moral outrages, or anything that you want to get across, type it into your Facebook commentary. I'm joined by my colleague here, our IT savant, all-purpose savant, Phil, who will relay the messages to me so we can drill down on anything you like. Anyhow, today's workshop, somebody titled this. I didn't name it. I didn't get to pick it, but kudos to whoever named the workshop because it's called Keeping It Straight, the Importance of Chiropractic Care. So straight is a big word in the profession of chiropractic for a number of reasons. What are we talking about here? The straightness. You guys want the straight, cold, brutal, bitter facts? We want to keep our spine straight and work on our posture, or we can talk about straight chiropractic. Chiropractors are divided into many different categories and many different headings, and one of the big divisions within the profession are called the straights and the mixers. The straights are people who believe that chiropractic is a matter of adjusting the spine, and the mixers believe in everything else. I myself am a mixer. We do chiropractic adjusting to the spine, to the extremities. We do muscle release techniques. We talk about nutrition. We talk about exercise. We use physical therapy modalities here in the clinic, which include a laser, a cold laser treatment. We use what are called Graston release tools. They're like stainless steel combs to go over trigger points with. We use a cloud device, which is a mitochondrial enhancement. We do compression boots to aid in lower body circulation. These are all things that straight chiropractors avoid, but as mixers we use here. If we're going to talk about chiropractic and what keeping it straight, we certainly have to talk about good posture and how important that posture is to stimulate your nervous system to achieve complete and total comprehensive ranges of motion as far as you're capable of going. And we got to talk about the straight, cold truths and the facts and make sure that we dispel a little bit of mythology and that we are able to leave you all with a better understanding of what it is we do here. So far, so good? All right, once again, the live and in-person crowd are welcome to raise your hand and join the workshop. If you are out in virtual land, you're welcome to type in and join the workshop. But anyhow, first we got to go over some important dates on the timeline. Let's go back to the Stone Ages, first of all. People who look at cave drawings, people who look at hieroglyphics, people who study human history that far back in the time believe that they see cave drawings and hieroglyphics and other types of art depicting humans manipulating each other or doing hands-on body, somatic means body, the soma, somatic hands-on treatments. So for the people who are chiropractors now, we take a little bit of pride in that and say, well, see, it stood the test of time. We got started at the very beginning with the types of treatments that we're doing. At the very least, there's evidence that Chinese martial arts masters did body manipulations and somatic manipulations as part of very advanced martial arts. There's evidence to suggest that Russian bone setters, every indigenous culture around the world had somebody doing some sort of hands-on treatment. So we, in terms of what it is that we actually do with our patients in the treatment room, working one-on-one with our group, we've survived since antiquity. We can claim success for all of human history. But let's jump ahead to 1895, the next important date on our calendar, where D.D. Palmer made an adjustment or a manipulation to a deaf janitor. and this man regained his hearing almost immediately, leading historians to conclude that the chiropractic adjustment was a cure for deafness. Well, it didn't exactly work out that way. This was one observation of one patient, and as it turns out, even in 1895, prior to the internet and prior to social media and being able to get your message and your word out across all the land, people who had conditions knew other people who had conditions. So this janitor whose hearing was regained, he got his word out, and all of a sudden, people who had conditions that didn't respond to typical medication started flocking towards Davenport, Iowa, where D.D. Palmer had opened up his first clinic, in order to hopefully find some sort of relief. So the Palmer family opened, let's just call it an alternative hospital. And so the very beginnings of chiropractic care in this country had nothing to do with back pain and everything to do with treating patients who had challenges that didn't respond to what was then known as medicine. Because of the tools that he had at his disposal, Dr. Palmer was a straight chiropractor. He was not a mixer. He didn't have the physical therapy modalities that we have today. He did not have the understanding of anatomy and physiology that we have today. But he had some success. Maybe there was tremendous disappointment for a lot of people who showed up at his clinic who did not get relief, but he wasn't skunked. He was able to help quite a few people, but he was unable to explain why it was that what he did worked based on the science of the day. If you flash forward to 1901, that was the year when the Rockefellers got involved in what's now known as traditional allopathic medicine with petroleum-based medications. So medicine really went its direction that we know it now as a surgery-based, a medication-based, pharmacological-based entity. In 1901, they really got their start as what we know as the beginnings of modern medicine. In 1920, one of Dr. Palmer's graduates, a fellow named Clarence Gonstead, built a clinic in a place called Mount Horeb, Wisconsin. Now, Dr. Gonstead was an engineer prior to becoming a chiropractor, so to him, everything was quite mechanical. He was really the first known chiropractor to x-ray a spine, draw markings using engineering principles. He used the high school geometry equipment of a ruler and a pencil, and he drew dots and he connected dots. And then he made his adjustments. He had Dr. Gonstead had disfigured hands. So he would make his adjustments with his hands in a very contorted position, and he would take very, very specific contacts on what he was adjusting simply because that's what he was able to do. And he would adjust patients' spines in very specific plane lines as dictated by the x-rays. And this is where we got the concept of bones out of place, and we're going to realign the architecture of the skeleton, or at least the spine, according to Dr. Gonstead. Now, Dr. Gonstead was so successful that Frank Lloyd Wright designed his clinic. You might have heard of Frank Lloyd Wright. He did Falling Water here, local to southwestern Pennsylvania. So we know that architect pretty well. The Gonstead Clinic had an airstrip adjacent to it because farmers from all over the Midwest would they would work their fields, they'd fly into Mount Horeb, Wisconsin, they would get themselves adjusted, and then fly back to wherever it was that they came from. So Gonstead is really a very well-known figure in historical circles amongst chiropractors because he had a specialized technique. He introduced us to the concept of a misalignment that he was correcting, and he was very successful. Now, the problem for Dr. Gonstead arose when he would re-X-ray patients. We did some X-rays. We determined that your alignment is off. Your architecture of your skeleton is inappropriate. So we're going to take steps to correct it. Then a period of time later, well into a treatment plan later, a new X-ray, and we see the same misalignments. And the patient has to ask the question, well, I'm feeling so much better. I know that there are changes. My ranges of motion have improved. My comfort living in my body has improved. I feel all my physiological functions are improving. Why has my architecture not changed? And that remained a mystery for a period of time to come. How does this work? We had Dr. Palmer restore a man's hearing. There's no nerve involved in the neurological circuitry that involves hearing that exits the skull. So if we were to say that maybe there was a bone out of place that pinched a nerve that prevented this man from hearing, and then we moved that bone and it let the pressure on the nerve disappear and his hearing was restored, well, we can't say that because there's no nerve that exits the skull that's involved in hearing that would be alleviated of pressure by manipulating the spine. Dr. Gonstead was unable to demonstrate changes in skeletal architecture, and yet all of these patients are feeling so much better. So we still don't know exactly why chiropractic adjustments and chiropractic care are so effective quite yet, going by this timeline. Now, the Palmer family, they established the Palmer School of Chiropractic, and they had this big clinic with all of these patients who were just not responding to traditional medicine. They're developing this great big mecca of chiropractic in Davenport, Iowa. And they're particularly fascinated by and limiting their treatment to the upper part of the neck. Even to this day, there are chiropractors who limit their practice to the upper, it's called the upper cervical spine. The neck, of course, being the cervical spine, upper being the place where the skull actually rests upon the vertebra. So another one of their graduates, Dr. Logan, Hugh B. Logan, was practicing in Kansas, and he had an innovative idea. What if the problems were not all treatable by adjusting and manipulating the upper cervical spine? What if it's all lower back? What if it's sacrum? What if it's pelvis? What if it's the bones of your hips? And if we could level the base, then everything above it would stand to reason that the architecture would improve this way by working from the bottom up. Seemed like a good idea. In fact, it was such a good idea that Dr. Logan ended up focusing his practice on what's called the sacrotuberous ligament. The sacrotuberous ligament attaches from the sacrum to the pelvis, and it's actually an attachment point for the hamstring muscle. So for people who have tight hamstrings, you can almost diagnose yourself on that one, feeling the tightness and the irritability and the pain in the back of your thigh. Maybe Dr. Logan had a very good brainstorm for you where if we could get some laxity into that sacrotuberous ligament, the hamstrings don't have to pull as tight, and the pelvic basin and the sacrum will be able to become level. Dr. Logan enjoyed so much success that he actually opened up a college to teach his technique. It's called Logan College. It's Logan University in St. Louis. My colleague who practices here with us, Dr. Philip Ross, he's a proud Logan alum, and he represents the institution very well with his work here. And even to this day, Logan University teaches the technique that Dr. Logan founded in the 1930s. All right, so let's flash forward a little further along on our timeline to 1997. So we're going to skip way ahead when an an ambitious and eager chiropractic student named Gideon Orbach met Dr. Ted Carrick, Dr. Ken Erickson, Dr. Mark King, and Dr. Mark Charette, who even to this day, more than 25 years later, over 20 years into practice, still regards these people as his friends and mentors. These are the people who finally figured out and were able to understand exactly what chiropractic adjustments do, how they affect the body, how they affect the brain, and why they're so successful. And what we have to do is we have to begin to look at the working relationship between the brain and the body as a series of feed forward, feed backward physical mechanisms where we're going to use the body as a tool in order to stimulate the brain. Once the brain is stimulated, the brain is going to have better communication, more advantageous communication back to the body. So, if you study the neurology of the joints, not just the spine, but the entire skeleton, and we think about what goes on where two bones meet, where we have a surface where two bones articulate with one another, they're what are called receptor pools, pressure-sensitive joint mechanoreceptor pools that live in those joints. So if we're able to stretch those joints and move those joints through a full comprehensive range of motion beyond what that body is capable of doing by itself, let's think about that as neurological stimulation. Now I can look at my finger, kind of straighten out my finger like so, and I can stare at it, and I can get out my dowsing rod, and I can wish upon a star, but that's as far backwards as it'll bend. But if I take my other hand of force and I push it back a little bit further, look how much I have, almost another 90 degrees of range of motion that finger is capable of that I can't do by myself. This is kind of cool. I got people sitting around watching me, and some of them are actually doing little finger tricks now. If you're out there in Facebook land or YouTube land and you're watching and you're playing with your own finger saying, oh, I never really paid attention to that before, you're not alone. So now, what if we very gently take that finger slightly out of socket by tractioning it and then bend it backwards? We have even greater ranges of motion. And that's where chiropractic adjustments live. What we're doing is we're moving our joints. The chiropractor is moving the joint through an entire range of motion that the joint is incapable of moving on its own, yet capable of moving with appropriate force. So what happens there? When those pressure-sensitive joint mechanoreceptor populations that live in those joints are activated, which is exactly what we're doing, they start to send impulses through the body into the spinal cord, ascending through the spinal cord, up into the brain stem, and then into different parts of the brain, most importantly for the purposes of our conversation, into the thalamus. That's the area of the brain that's the most aware of sensory stimulation, and it routes the neurological stimulus to the appropriate sensory end organ. We'll come back to that in a moment. Those same neurological stimuluses go to the cerebellum, the area of the brain that's heavily implicated in coordinated movement, balance, equilibrium. And so when we make chiropractic adjustments, whether it's to parts of the spine, whether it's to the fingers, whether knees, ankles, what we're essentially doing is we're giving the brain more tools in order to give information back to the body, more tools to better balance ourselves, more tools to be able to locomote or coordinate and move our bodies through space. So far, so good? All right, once again, audience is invited to participate, and if you're in Facebook land or YouTube land, you're also somebody said it isn't working, and I'm not sure if she means the chiropractic's not working, her finger's not working, the heating in the building is definitely working. I'm being told that it's cold in here. There's always a heckler. I don't know why. Any- anyway, anyhow, all right. So anyhow, back to me. In 2023, we're skipping ahead in the timeline a little bit. Chiropractic is expected to generate about $19.8 billion worth of revenue in the United States. $19.8 billion. That sounds like a lot of money to me. But at the same time, I looked into this a little bit and I'm following along and I've gotten conflicting information. Medicine is expected to do, conservatively speaking, $808 billion in that same year. So let's see. We did 19.8, say over 808. Not even close. Not even close. But medicine, if you look at more economics, we're also projected to be in the neighborhood of about $100 billion in lost productivity due to pain. We're looking at about $34 billion in terms of out-of-pocket expenses. And then if you look at chiropractic patients, approximately 30% fewer surgeries, especially back surgeries. You're going to have so far fewer sick and in pain, I can't go to work days. Immune system is going to be at a higher function. And you wonder why we can't get endorsement from our medical doctors. Why does the AMA, why does the big pharmaceutical companies, why are they so anti-chiropractic? Well, we're cutting into their market share. I mean, it's an economic decision. How do you blame somebody? How do you approve of somebody who's getting in your way of making more money? So we've survived since antiquity. People have been doing for each other what chiropractors are doing for their communities, for their populations now since cave drawings. We generate something like, 1/10%? No, more than that. We don't even do 10% of what medicine does annually, and we make such a dramatic decrease into somebody else's market share. So we survive as a profession because we are so successful at what it is that we do. Now, my opinion, and I speak for myself, I don't speak for the entire chiropractic profession when I say this, my opinion is that it's a mistake to treat a patient in such a way that we're chasing their pain around. More than 9 out of 10 of my new patients come to see me because they're in pain. And that's what brings people in. And if we study the neurology of pain, anytime you have tissue destruction, maybe torn body tissue, a mechanical traumatic impact injury, a change in the internal pH, shifting a person to be more acidic, a change in the temperature. I mean, we've had some up and down temperature here in Pittsburgh the last 3 days, a change in the barometric pressure. We've also had plenty of barometric pressure changes here over the last few days. What happens is that what are called nociceptors. Nocere means to harm. It's the Latin for harming. Nociceptors become activated, and they stimulate the brain, and the brain starts to perceive pain, and the brain tells the body that, hey, look, we're in pain here. We got to do something about this. So let's think about those pressure-sensitive joint mechanoreceptors that we excite with chiropractic adjustments, and we're going to think about those tissue-harmful, acidic toxicity, temperature-sensitive, barometric pressure-sensitive nociceptors. They're on a push-pull continuum. So once we start to activate the good stuff, once we start to activate the joint mechanoreceptors, we're going to start to suppress or to limit or inhibit the brain's ability to feel those nociceptors, so we're going to start to decrease pain. Now, when a patient comes in and they say, I'm here because my shoulder hurts, or I'm here because my back hurts, obviously we have to look at those places in their body and we have to do things to correct the biomechanics in those areas of the body. Now, as I mentioned, I'm a mixer. I'm not a straight chiropractor. That means I will look at people's shoulders. I will look at people's hands, at their feet. That means we will do physical therapy modalities. We will look at what are the muscles doing. We will look to stretch, strengthen, and stabilize muscles where it's appropriate. Those are all pieces of the puzzle, and they're all pieces that a mixer chiropractor can help you with. So if we look through, if we make a treatment goal of getting somebody out of pain, what we don't know is what's that patient's individual, personal, unique pain threshold. Some people, you adjust them once or twice, and they have not a lot of sensitivity to pain, and they resolve very quickly. Their mechanics might be faulty. Their push-pull relationships between their muscles and their skeleton might not have been resolved, and those pressure-sensitive joint mechanoreceptors might not be completely and totally set to on. But because they have such a threshold for pain that it takes so little to make it disappear, those patients have euphoric relief. Other people, it's impossible to predict. They might have very severe pain tolerances, and it might not take a lot to offend their sensitivity. It might not take a lot to drive them over the edge experiencing pain, but it might take a whole lot to shut that mechanism down. So we don't base our treatment plans on how much or how little pain somebody's in. We base our treatment plans on how well are you moving? Are you able to move more comfortably in your body? Are you able to be more physically assertive, physically active? Is your threshold increasing? For example, we have patients who come in and they say on their first visit, one of the most important questions we can figure out is, what is it that you like to do that you're unable to do, that you're unable to perform because your physical aches and pains are so severe that they're limiting you? And one of my classic examples is I get from patients are people who like to work in their gardens. And our conversation goes in such a way where they tell me that they usually work in their garden for about an hour and a half, and then they need to take a break. And then they had some sort of an injury, or they had some sort of pressure-sensitive joint mechanoreceptor, nociceptor imbalance, skewed in favor of the nociceptors. And now they work in their gardens for 10 or 15 minutes, and they start to ache, and they feel like they're limited. And we get rolling along with a treatment plan, and they're doing, in my opinion, they're doing better, but they still have pain and discomfort. But they can't wrap their minds around the fact of how much better they're doing because their pain is not an on-off switch. And then we come back to our conversation and we say, well, have you been in the garden recently? And they're like, yes, I worked in the garden for almost an hour the other day. And say, let's drill down on this for a second. You were unable to work in the garden for 10 or 15 minutes when we got started. Now you're up to an hour. And the patient has that light bulb moment and a big smile and aha, and they start to realize how much progress they're making. So we want to measure what we do in terms of people's unique life experiences and their activities of normal day living and how they feel getting through their day. So maybe your day is working at a desk in a home workstation that you set up, and you spend 6 to 8 hours in a row sitting in front of the computer screen doing the work that you're tasked to do. And maybe at about hour 4, that headache starts to show itself. And by hour 5, it's pounding. And you're looking at your watch and how much longer do I have to sit here? When can I lie down? When can I just call it a day? This feels horrible. Am I going to be able to endure another 2 hours of this workstation? And the cycle repeats every day, day in and day out. Well, if you're sitting at, if we think back to the title of our talk, and we think about the keeping it straight, let's ask a critical question. How's your posture at your workstation? Are you holding your head up straight and tall the way you're supposed to? Or are you really leaning into the computer, creating tightnesses in one group of muscle in your neck and laxities in another, disrespecting the push-pull relationships that hold your head and neck up, not necessarily sliding the bones of your neck and the top part of your rib cage out of place, but certainly getting the joint surfaces to stop moving with one another through their ranges of motion, inhibiting the pressure sensitive joint mechanoreceptors, allowing the nociceptive population to increase in their activity. Well, we see a lot of those patients who fit that profile here at our clinic. And we teach them a few exercises to reinforce what we're doing, and we do some work to release the joints of their cervical spine, and to release the joints of the rib cage, and to release tight spasm muscles and increase their ranges of motion. And then all of a sudden, that headache that they were having at about hour number 4, maybe they start to get a little trace of it at hour number 6 as they're wrapping up their workday. So I ask you, the headache didn't completely disappear. We still have the same problem, but what we've done is we've expanded the threshold for which that problem is capable of living in, and we've made it easier for that person to be able to get through their day and to work in a closer to pain-free environment. We're doing that by focusing on what they're capable of doing physically, not on some sort of a measuring stick of how much pain they're in or not in. So far, so good? Questions, comments, moral outrages from the universe? All right. Well, once again, if you're listening in on your device, if you're on our Facebook page, if you're on our YouTube page, and you're joining me from parts unknown, it'd be great to hear from you and let us know where you are. And if you have questions, comments, moral outrages, or if something I've said is ambiguous to you and you'd like to drill down on it a little further, you are invited to reach out. All right, so that being said, what are we doing here? We're using the body, specifically the movement pattern of joints, and the relative tightness of the musculature and the connective tissue, the tendons which connect muscle to bone, the ligaments which connect bone to bone, the fascia which wraps itself around the muscle and lubricates, allowing for an ease of movement of one muscle on top of another. We are stimulating that tissue by moving it through its range of motion, exciting the sensory areas of the brain and the coordination areas of the brain, and giving the brain more capacity to generate output into the body. So what does output mean? Output means we're going to enhance the immune system. It means we're going to do a better job of regulating the heartbeat, the blood pressure, the respiration rate in relaxed, calm terms rather than a fight or flight state. So, all those nociceptors that we talked about, the neurological tissue that indicates that harm has occurred, that indicates that there's an injury to the body, that tells the brain, danger, Will Robinson, danger, we have a problem. All of those nociceptors dump into the brain stem. That's the area of the brain that controls vital function, heart rate, respiration. They dump into the cerebellum, the area of the brain that causes us to balance ourselves, to move in a coordinated, easy to float through space fashion manner. All those same areas that are positively affected by chiropractic adjustments are also positively affected by exercise. So we want to do exercises and we want to do physical activity that allows the cerebellum and the brain stem to work in a calm, relaxed, easy to negotiate manner. We just got done talking about heart rate and respiration, and we want to be calmed down. Okay, nothing is all good and nothing is all bad. We take our nervous system and we can divide it into two categories. We got the voluntary nervous system and we got the non-voluntary nervous system. When I talked to you about the voluntary nervous system, about a few minutes ago, we talked about that finger and tractioning it and the range of motion and how much more you could bend it with your other hand than bend it by its own. I'm here to tell you, if you're in Cyberland and you might have missed our audience, it was a little funny to watch people almost on cue just start playing. Oh, I never noticed that. He's right. Anyway, so that's all voluntary activity. If I ask you to bend your finger back as far as you can, go for it. If you don't feel like indulging me, you don't have to. That's voluntary nervous system stuff. What we're interested in this part of the communication is non-voluntary nervous system, the stuff that you really just don't have conscious control over. We're going to call that section your autonomic nervous system. And then we're going to subdivide the autonomic nervous system into two categories, the sympathetic and the parasympathetic. Nothing is all good, nothing is all bad. We need to have both. The sympathetic nervous system is, we're all wound up with our sympathetic nervous system. That's our fight or flight. When we're in a sympathetic dominant scenario, we're going to have increased heart rate. Our blood pressure is going to go up. Our respiration, our breathing rate is going to go up. We're going to have an increase of cortisol. You guys all know that an increase of cortisol means an increase of stress. We've got to lower stress levels. We got to decrease the cortisol. In the family of events and mindsets and attitudes that occur with too much sympathetic nervous system, we have PTSD, post-traumatic stress disorder. We have depression. We have fatigue. These are a decreased function of an immune system, increased brain fog. These are all conditions and challenges associated with a sympathetic nervous system that has gone on to overdrive. We have to have the sympathetics. Got to have them. We're going to have a life and death scenario. We're going to get into our fight or flight mindset. Now, if a saber-toothed tiger comes breaking in through this front door and starts snarling at all of our customers and clientele, how many of you are going to stop, analyze the situation, say, oh, big kitty, let me throw out a little strand of yarn for it to play with? And how many of us are going to move at top speed to exit the back? That's our sympathetic nervous system, compatible with survival. I personally vote, let's go out back and barricade the saber-toothed tiger in the building until people who know what they're doing with it can come and take it away. That's my vote. Let's survive. That is sympathetic fight or flight in action. We have to have it. Now, as you're sitting here listening to me talk, I don't think I've offended anybody. I hope I haven't. I'm not looking to pick a fight. I'm not challenging your belief systems. I'm just giving you some information. I'm just giving you this, keeping it straight. The straight talk about what chiropractic care is, why it would benefit you. We're having a good old time having this conversation. Hopefully, you guys are all in a parasympathetic state right now. That's the wine and dine and the relaxation, and the heart rate goes down, and the respiratory rate, breathing rate goes down, and the blood pressure goes down, and we're digesting our delicious pro reds and pro purples and protein shakes. This is where we want to be. So let's challenge our parasympathetic state to come alive. Let's do some deep breathing exercises. What I want everybody to do is sit up as straight and tall as you possibly can in your best posture that would impress your chiropractor. And I want you to take your shoulders and just kind of throw them back and let them relax. And as my shoulders come back, my chest comes forward. And I'm going to make myself tall in my abdomen. I'm just separating the bottom of my chest from my belt buckle. So I'm becoming tall and long in here, and my shoulders are back, and my head is up. And all of a sudden, I feel like I'm in a really relaxed, comfortable place because this is how my posture is designed to be. Now, if you're having a difficult time achieving this position, it's very possible that you have a sequence of tight muscles throughout your paravertebral, the two columns of muscle along your side. It's possible that your spine is not moving the way it's supposed to. It's possible that those joint mechanoreceptors throughout your thoracic spine, your mid-back where the ribs all attach, are not sending the right information into your brain. And it's quite possible that you might recognize this deficiency in yourself and think, I want to go see my chiropractor, who's a mixer, who will use a number of different modalities, including a chiropractic adjustment, to help me achieve better biomechanics so that I can sit in better posture for longer. Anybody spend some quality time driving, watching TV, working at the computer? These are all sitting places. All the activities of sitting were dependent on good posture to be as effective and as efficient as possible. Do you stand for work? If you stand for work, how come you don't get tired so quickly when you stand up straight and you have good posture versus when you slouch and you change the musculature torques on your skeleton and you think, man, I want to just go sit down. This is not comfortable. So if you find yourself with these specific challenges, just shoulders back and down, chest is up, torso is long, head is up. If this is a difficult position for you to get into, let's talk privately behind the scenes. As long as you're here, let's all take a big deep breath in through our noses. We're not unlocking our posture. I'm bringing in as much oxygen as I can without shrugging my shoulders up. What I'm going to do is let my shoulders just keep drifting backwards and further down. So big deep breath in. And my chest and my abdomen is expanding. And I'm going to hold that breath for 1,001, 1,002. And now I'm going to blow it out through my mouth. Let's do that again. Big deep breath in through your nose. Torso remains in good posture, but it's expanding to accommodate for those lung expansions to hold on to more and more delicious oxygen. And we're going to blow out through our mouths. One more time. Big deep breath in through your nose. Good. We're expanding. We're expanding. Lungs are getting big. And blow out through your mouths. Now, if I suggested to you that if you want to be healthy and you want this to work and you want to get rid of your aches and pains and you want to treat your body like a upscale real estate that you live in a mansion, you need to go hire a personal trainer and you got to go to the gym and you got to lift weights and run on the treadmill and go swim and play a few games of racquetball for 2 hours a day every single day. One of you, more than one of you, is going to say, I don't have the time for that. No way. I get it. That's not what you need to do. What I'm telling you is the exercise that we talk about right now, these couple, 3 deep breaths, this is to activate your parasympathetic nervous system and slow down your sympathetic nervous system and get yourself into a relaxed wine and dine state. It's a brain hack. A brain hack by doing deep breathing exercises. Now, if any of you felt like I had an energetic shift, I took 3 deep breaths with you, Orbach, and after those 3 deep breaths, like I just felt lighter. I felt maybe a little bit more aware. I felt a little bit more comfortable in my body. I felt a little bit more relaxed. Well, hopefully you had an aha moment and you can see where taking a break from your normal activities all the time throughout the day to take 3 deep breaths in a row, maybe 10 times a day, still be able to put in your 10-hour workday and just take 3 deep breaths. It should take you a minute, 10 times over the course of the day and look at the dividends it's going to pay for you in terms of how we get into a parasympathetic relaxed state versus how we're in a sympathetic fight or flight state. I'm going to lead a workshop on Friday. This is what's known as a shameless plug. We're going to talk a lot more about this. We're going to do holiday tips at that time, and we're going to talk a lot more in detail about getting yourself into a wine and dine relaxed environment in contrast to that wound up, tight, sympathetic. So this is partially a teaser for you to come back and work with me on Friday. In the meantime, chiropractic adjustments. We're going to stimulate the exact same areas of the brain in a different way than the deep breathing. One does not substitute for another. If we think about what goes on in a mixer chiropractic office, which is exactly what we have right here, we have the dynamic of nutrition, the element of a glorious, fully stocked nutrition store right here in this building. Now, I know that there are a lot of presentations throughout the week of people talking about specific nutritional products, and I want to talk about the importance of being a chiropractic patient, but I would be remiss not to mention a few things. As long as we're trying to get out of sympathetic and into parasympathetic, there are a few key nutrients that we really need to fortify our bodies with to help with that shift. Vitamin B, B as in boy, vitamin C as in Charlie, vitamin D as in David. And you might recognize that when we talk about immunity and protecting your body from miscellaneous and various viruses, including the influenza that happens seasonally, what do we talk about? Vitamin C, vitamin D, immune system boosters. Vitamin C, vitamin D, we're going to help shift out of a sympathetic dominant state into a parasympathetic state, which enhances the immune system. A couple other things to think about. Magnesium. Magnesium helps make the shift to parasympathetic. Now, when we talk about what we're doing here from a musculoskeletal perspective, what supplements can I take that will help unwind my tight muscles? Well, magnesium has to be number one on the list as far as I'm concerned. Vitamin B has to be on that list as far as I'm concerned. And here we are talking about vitamin B and magnesium as being components of how do we shift ourselves more parasympathetic, less sympathetic, better immune system activity, more neurological stimulus, more neurological outputs to fortify the immune system. Omega-3 fatty acids, the fish oil. We talk about that as an anti-inflammatory. We talk about that as heart health. We talk about that as brain food. What's it doing? It's helping us make a shift from the sympathetic nervous system to the parasympathetic nervous system. So far, so good? Questions from Cyberland? Okay. To my left is somebody who does not get nearly enough credit around here. IT savant Phil, who mans the station and takes care of all of our technology and is interactive with our Facebook media, our social media, our group Facebook page. And he's kind of a quiet behind the scenes guy because he's not a clinical guy, but we just simply couldn't do it without him. And that's hard facts. So I want to just quickly summarize. If you think about being a chiropractic patient, it takes effort. You have to show up. I cannot treat you over Zoom or over FaceTime, but I can certainly give you suggestions of things that you can do for yourself over the phone or over FaceTime, and I'm happy to do so. What we're ultimately trying to do is put the body in a more advantageous physical functioning manner by improving posture, by increasing ranges of motion, because when we're able to do those things, we're able to stimulate the nervous system, the entire nervous system, the peripheral nerves throughout the body, and how they send messages to the central nervous system, the brain and the spinal cord. And then the brain generates output, enhancing all of the other body systems. And chiropractic adjustments are a time-honored, dating back to, at the very least, hieroglyphics ages, recognized successful modality. We talked about really the pioneers of chiropractic who started in this country in the late 1890s and in through the 1930s, who really set us up for what we're doing today without answering the question of how does this work. And then we talk about people who I've personally encountered who in the 1990s were able to explain how the physiology works and how chiropractic adjustments affect the physiology. And now here we are in 2023, and my parents are big time New York Times people. They get the New York Times delivered to their apartment. And earlier this year in the summer, there was an article talking about the neurology of pain. And my mom cut it out for me. She's like, "Oh, you're going to be so excited. You can't wait. You're going to read this and maybe you'll learn something." And I looked through the article, and they're citing the same researchers and the same information and the same studies. And of course, the follow-ups to those studies to verify the originals that I was studying in the late 1990s. So I'd like to be able to tell you that I'm a little bit ahead of my time, being able to explain range of motion and decrease pain and why the modalities that we use work. Love to have the chance to help you with any number of physical complaints here at the clinic. I speak for my colleague, Dr. Ross, as well. We have a lot of modalities in our not straight but mixer clinic. And we look forward to meeting you if you give us a chance. Thank you all so much for your kind attention, for indulging me. Do your deep breathing exercises, and then tune in. I'm speaking at this time on Friday, and we'll do a little bit of overlap and a little bit of new stuff about more strategies that you can do for yourself.